Hi, my name is Randy Blas, and I'm a therapist through Habercrest Counseling. I am reaching out to you because I want to get out to the emergency services some additional information. I define emergency services everything from EMT to paramedic to ambulance person to fire department to police department to whoever is working with those that have been traumatized. From 9/11 and thereafter, I've worked with a number of people, a large number of people, I forget the National Guard and military, that have been working with other people that have been traumatized. And I'll go over symptoms of trauma in a minute. What I found over and over again is that if we're dealing with a lot of trauma normally, and then this trauma on this scale, then it can affect us greatly. Doesn't mean that we're screwed up or that there's something wrong with us. It does mean that we're human. I've had police not want to say something to anybody because they don't want to go to the enemy, the psychologist on the job, or they're afraid of how it may be taken, or will it affect promotion. I've had other people with the same thing. So when I read down later on a list of symptoms, please know these are normal reactions to trauma. Okay, so again, normal reactions to those events of traumatic. What I tried to do with this information and video is to get the information out for people to know, like I said, what to do, and to let you know I'm here if ever needed. And if I'm duplicating what somebody else is already doing, then you can not worry about it, but I want to make sure that it doesn't get lost. Because each department or each area is so diverse, I don't know where and how to get it out. I'm hoping you do. When we deal with PTSD and we've done some symptoms, we're looking with avoidance symptoms, we're looking with shutdown symptoms called dissociation, we're looking at people that may be having nightmares of the event or re-experiencing it otherwise, flashbacks. We can be looking at other behavioral changes later on. But it can range from those physical symptoms of heart rate high, muscle tremors high, blood pressure high, visual difficulties, sweating, chills, not only at the event, but a long time later, if something in the present picks up a feeling in the past and it gets felt now. I had one cop who had been driving down, I don't know what the smokestacks were, Queens, I'm not sure, and had a panic attack, couldn't figure out why. And he had been blown under a bus by the black cloud of 9/11. I have other people that were affected differently by with EMTs by body bags, carrying out a couple of them, and the bodies going together like one of those sets of balls in an executive pendulum thing. We record this information, and it gets triggered when something is similar. And I'm going to go through the other symptoms in a moment, but what happens is we shut down. So I don't want to think about it, I need to do this, we put all our feelings in there. We keep that tank locked up, except at some point something hits those buttons, and we let those feelings and thoughts out, but just not in ways that we would normally do. Some of the other symptoms: confusion, poor attention, poor decisions, hypervigilance, sitting with their back to the wall, looking outward. And I'm talking about somebody who previously wouldn't do that, because I know some people on the job will sit like that. But being extra scanning and aware, extra afraid, overreactive. There may be memory problems, the awareness of surroundings, and the not being able to deduce for a while is when we first traumatized. We may have disturbed thinking. I'm not talking crazy. I'm talking about where things bother us. We may have nightmares and images that something comes into our mind and we go, holy crap, what the hell is that? Not unusual for what I run into. Anxiety attacks, guilt, grief, severe panic, all of that I see in practice. It doesn't all have to be there at once, but it's there. Emotional shock, fear, loss of control, depression, those can also be there. Second guessing yourself, overreacting to other things that we go into why. Feeling overwhelmed, anger, irritability, or agitation. These are not craziness symptoms. These are PTSD and or trauma symptoms. Behaviorally, we wind up seeing a number of symptoms as well. Changing activity that we used to do, withdrawal, emotional outburst, and we don't realize after why that we had an outburst and wonder why. Suspiciousness, change of communications, overeating or undereating, increased alcohol use, or substance use, or gambling, or overeating, or cutting and carving, which I'll see sometimes in teenagers, or avoidance, any of those symptoms that are to protect, or that we're trying to protect, that can become a problem in and of themselves. Relationship problems, body complaints can increase. Extra alert to the environment, pacing, and sometimes changes in sexual functioning. Trauma and PTSD can be considered, I consider, like something being recorded onto a hard drive or put into a memory album, something we want to see. But if we pass by something that triggers it, we can wonder why something comes from. So anything from a waterfall to seeing the boardwalk not there, to a date, to any of the other kinds of triggers that can be, can have a profound effect. There's a lot more information on trauma. If I can be of any help and give more information, my name is Randy. It's at harborcrest.com. So you can reach me at Randy, RNDY-harbor-crest.com. Randy at harbor-crest.com. And the cell number is 845-821-1635. And if people can forward some of the information to those people that need it, please let me know. I'm not only concerned about now, but 3 months, 6 months, 9 months, and a year, there will be reaction from a number of people. Some can go through the trauma unscathed. Others will react. And again, it's not craziness. It's something that's horrific that people need to deal with. So again, 845-354-9200 is office. 845-821-1635 is cell. Or email me at Randy at harbor-crest.com. And if you can forward this along, great. If it's already happening where people are planning for the next few years, great. My fear is that because things are so disjointed or so spread out, my fear is that nothing will occur, and that to me would be the worst thing to happen. Take care, and bye-bye.